Hello, this is my video on how to perform CPR on adults, children, and babies. So first, what does CPR stand for? It stands for cardiopulmonary resuscitation, which is all about the heart, lungs, and overall recovery of a person. All of the information that I am about to give you is from the American Red Cross organization. A great place to get good information and stay up to date on things that are happening, changes that are discovered, whatever. So there are 7 steps for CPR on adults. So step number 1, you're going to want to make sure that the environment is safe, that you are going to be safe while performing compressions. You want to get, your first impressions of what's going on, what's happening, what you need to do. And then you're going to want to acquire personal protective equipment, or PPE for short. So step 2 is if the person is not responding and they are not breathing, you are going to want to look for obvious signs, life-threatening signs like bleeding or conditions, anything that you can just see. If they are still not responding, you want to dial 911 and just let them know the situation, let them send people your way, and you're going to want to get any equipment that you are going to need while performing CPR. So step 4 is you want to lay the person on their back on a firm, flat surface, and then you're going to want to kneel or stand next to them, whatever is more comfortable, and your body needs to be over them. So if they're on like a table or something, you can't really be on your knees for that. It wouldn't really work because you really have to put, like your whole body into it. So step 5 is just 5 little things to remember about giving compressions. So number 1, you're going to want to have the hands overlapped on the center of the chest, just like this person, or like this person right here where their fingers are interlocked. And you want your shoulders directly over your hands with locked elbows. Compressions should be around, or the compression depth should be around 2 inches. You want to make sure that the chest returns back to its, like resting position before you continue compressions. The compression rate is 100 to 120 per minute, and you do 30 at a time. So step 6 is all about rescue breaths. So the first step is you want to tilt the person's head back just to open the airway, and you plug their nose and put your mouth over their mouth to create a seal and blow out 2 times, about 1 second each. You want to make sure that the chest is rising. If it is not after the first breath, you might want to retilt the head, make sure that that mouth seal is good, and then try again. And if the chest does not rise the second time, there may be something blocking the airway, and the person may be choking, which requires, the Heimlich maneuver, all of that, which I'm not going to go over in this video, but it is something to note that compressions and the rescue breaths probably won't help much if there's something lodged in a person's throat. Step 7 is you just continue CPR 100 to 100 compressions per minute, 30 at a time. You do not want to stop for more than 10 seconds, and use an AED, automated external defibrillator, and you've probably seen those in movies or whatever, but it basically shocks the heart back into beating. And yeah, that is everything. Thank you for watching. I hope you learned something. Yeah, I think it's super important to know little things like this because you never want to be in a situation like this, but if you are in a situation that you do need to perform CPR, you are probably going to want to know how to do it. So yes, thank you for watching. Hope you learned something.